Melanie Davis, and I come from Dallas, and I first want to thank everybody here for the wonderful opportunity to come and speak. Thank you, Dr. Gumler, I really appreciate it, and thank you, Janelle Greenlee. Before I get to Max's story, I wanted to tell you a little bit about my pregnancy. Back in February of 2008, I was 6 months pregnant with Max, and I had an 18-month-old girl at home who had been in daycare for the previous 9 months. I was probably the poster child for what not to do when you're pregnant because I had no idea about CMV and I wasn't nearly as germophobic as I am now. So I would let her sneeze on me, I'd finish her food, if I was in the middle of a diaper change, I would often not wash my hands. So I was the poster child in the morning for what not to do when you have a child in daycare. And I was in the middle of a totally normal pregnancy, everything was going great, and then I caught a cold that I couldn't shake sometime in February. It lingered for about a month, 2 months, sore throat, sniffling, sneezing, I had fevers, and they just thought, okay, it's a cold. They gave me some antibiotics, and it did nothing. So fast forward to April 30th, 2008, the day my son was born, I had gone in for a routine ultrasound because my daughter, when she was in utero, she was IUGR. Totally unrelated, we didn't know why, but they thought, let's just go ahead and follow up with this pregnancy too, which they did. I was at the doctor's office at the perinatologist having a routine ultrasound, and they hooked me up to the fetal heart rate monitor, and the heart rate wasn't changing. I sat there for a good 10-15 minutes, and no matter what they did, they gave me juice, they tried to stimulate my belly, they couldn't do anything to wake him up. Heart rate just stayed completely steady. So the perinatologist came in and did the ultrasound, and he said, why isn't your husband here? And I said, because this is a routine ultrasound. And they said, well, he really should be here. And I said, why? And the perinatologist said, well, we're not seeing the presence of anything bad, we're just seeing the absence of something good. So he said, go ahead and tell your husband to come down, we're going to stick you in triage just to make sure that, everything's okay. Well, 2 hours later, everything was still not okay. He hadn't moved barely at all. He'd rolled a couple of times. And at 5:45, they delivered my son by emergency C-section. And when they took him out, the OB doctor said, why is your amniotic fluid so green? They didn't know. He thought it was meconium, and they immediately got the NICU team in there and brought him to me. And he looked completely normal. He looked like he had normal skin coloring until I got real close and I saw petechia all over his face. I didn't know what it was. I said, what are those red marks? And they said, well, those are teeny tiny bruises called petechia. They whisked him away, and I was taken up to my hospital room, and within, 6 hours or so, the neonatologist came into my room, and he said, we think your son has CMV. And I said, what's that? And he said, well, it's a virus you can get and pass on to your baby. I was very foggy on drugs. I don't remember most of it, but I do remember him saying that he's got a grade 2 brain bleed. And I said, well, what is that caused by? He said, we think it's caused by the CMV. I think he said that. And then I said, well, what does that mean? And he said, well, he's also got something called PVL. And I said, well, what's PVL? And he said, paraventricular leukomalacia. And I said, well, what's that? And he explained it to me, and I couldn't tell you what it is now, but I knew it was really bad. So I said, well, what does that mean for him? What is that going to mean? And he said, well, he just may be institutionalized. So I hadn't even seen my son yet. One of the first things the neonatologist says to me is, your son may be institutionalized. So it was very, very disconcerting. And when I was admitted, when my son was admitted to the NICU, I found out later on that the first thing they said is, baby's got CMV and mom's an attorney. So they were very leery of me when I came in. They didn't like me. Immediately because I was an attorney, and I said, no, I do family law. It has nothing to do with medical malpractice. I promise. So within the next couple of days, we started to get a much clearer picture. There you see, and that's when he was very first born at the bottom. That's my husband's pink skin, and that's my son who ended up looking a lot worse than that. The bilirubin was so bad. I couldn't get a hold of his neonatologist, but I think the numbers of bilirubin, I can't remember if it was direct or indirect, it was somewhere in the 30s. And it was like that for weeks, and they put him under the UV lights, you can see there, they kept little goggles on him, and he was born at 35 weeks and weighed only 5 pounds, so he was pretty small at that time. Within a few days, I learned the wonderful terms of hepatosplenomegaly, I learned thrombocytopenia. When they put the PICC line in on the first night in his belly, he was bleeding so bad and there were no platelets to clot that the neonatologist, a different one at that point, had to hold his stomach in for 14 hours because he was just going to bleed out all over the place. He had 14 blood transfusions in the first 48 hours. And the bilirubin, like I said, was terrible. His jaundice was bad. His liver was failing. And no matter how many blood transfusions they gave him, the platelets would just continue to either stabilize and then go down, so they ended up just stopped transfusing him and hoping for the best. We learned over the next coming weeks, he was in the NICU for 93 days, and we learned that he had torticollis, which is his muscles were short on this side, so he would always have his head this way, or he would turn his head this way. He had nystagmus very, very bad, so we found out that the dampening point for his nystagmus, which I'm sure you know, but I'll say it anyways, quick shaking of the eyes. The dampening point that would calm it was when we were looking up there, so my son has a tiny flat part on the side of the head where he was constantly doing that. Hypotonio, he was super floppy. He stayed floppy. He didn't even lift his head up for like the first 9 months. It was just truly, truly a floppy baby. He was a back archer too. He would literally try to just backward bend into the letter C all the time. And one of the biggest complicating factors was the fact that he had a PDA in his heart that had not closed. Most babies, it closes right after birth. His did not. So then we were worrying about heart problems and pulmonary disease, and it was just awful. And of course, he failed the ABR. I mean, we kind of knew that. We'd done a preliminary research on the internet to know that he was probably going to be deaf. But the one thing he didn't have in the NICU that we were very pleased with was no retinitis. The ophthalmologist had come in, looked at him, and said his eyes looked perfectly fine, totally fine. And I would have shown you a video, but unfortunately it wasn't working. That's the video, and it's just a painful 3-minute video. This is actually 15 days before he came home. We thought he looked great, all right? We thought he looked great. Everybody in the NICU, you know, would kind of look at me like, really? You think he looks great? Well, compared to what he did look like. So I unfortunately can't show you that video. So there's Max now, but before I get there, I wanted to tell you a little bit more. The neonatologist and I had a very rocky relationship. He ended up becoming his primary and actually a very good friend of mine. But he didn't like me because I wanted to be well informed and I actually wanted to have a role in all of our decisions. I don't know what kind of parents they're used to in there, but apparently ones who don't want to be educated and want the doctors to make all the decisions for them. So I came in, I tried not to infringe or encroach upon his expertise. But we made them very aware that we wanted to be involved in all the decisions, especially with respect to ganciclovir. My husband is a PhD student working on his PhD in artificial intelligence, so he had access to white papers. And I learned later on that doctors hate nothing more than parents who read white papers and act like they actually know what's in them. So the neonatologist and I kind of started off on the wrong foot. I won't give his name because he hates it when I call him out in public. But the same week that Max was born, another child was born with congenital CMV within a matter of days, and 2 weeks later, the child died. So, needless to say, they were very, very discouraging and not hopeful at all. I kept wanting them to tell me, what's the future, and they said, no, there's 2 phases in this whole thing. The acute part where we keep them alive, and then what happens, you know, in the long run. So he was very pessimistic, very not hopeful, very discouraging about his ultimate prognosis. Even though his MRI came back normal, he still had the brain bleed. So between the possible liver failure, the fact that the PDA was unresolved, stubbornly low platelets, and the unknown residual effects from the brain bleed, the most hope, he said, that we could have was to take him home and keep him alive until he can have heart surgery a year later. So it was hard not to think about his future. So like I said, somewhere along the way, we started getting along very, very well. The neonatologist and I and my family, we became very close. And so I told him of Max's developments after Max came home. Like I said, he was there for 93 days and he came home. And I would let the doctor know all the Cliff Notes version of what had happened with Max. First time he smiled, first time he actually lifted his head, and he started eating jar food. And I told him I was coming here today to speak to all of you, and I said, okay, if you're sitting in the audience, well, what do you want to know? What do you know? And he said, I think you should go with your message that there is hope. And he said, show them what Max has done, show them what he's become, and show them that there is hope. So here's Max. In 2010, he has bilateral implants from Medell, and that's him walking with a walker, but he came home. When he came home, he still had the PDA. His kidney was huge, his spleen was huge, his platelets would not get above 100,000. He refused to touch hard toys, had huge sensory issues, oral motor issues because he had been intubated. He had still had the hypotonia, wouldn't bottle feed, so he had a G-button surgery after he came home. And then about 5 months after he came home, we took him in for a routine eye exam, and the doctor, I was really concerned about the nystagmus because the nystagmus had gotten so bad. And he said, well, it's not the nystagmus that bothers me, it's all the retinitis scarring. And I said, but Dr. Leffler, I said, Dr. Leffler, you saw him in the NICU. He said, I know, there was no indication of any retinitis. So it was a delayed onset retinitis. And if you ever see a paper by Dr. Lori Coors, it's actually a paper about my son because she was so surprised to see the delayed retinitis emerge in him. So as of August 2010, his liver has shrunk, his kidney has shrunk, his platelets are totally normal. He eats, he walks, he runs, he hears. His speech is terribly affected, but you know, we're working on its progress. And he's finally learned that hard toys are not the devil, and he can touch them and they will not hurt him. He lifted it, you know, when he finally lifted his head, it was the best day of our lives because he would just constantly keep his head down. He didn't even want to lift his head. But now that he's 28 months old, he's now in preschool with his sister. He started out in preschool 7 months ago with the 9-month-olds who were just learning how to crawl because we thought developmentally was the best place for him. And now he's eating and walking and running with all the 2-year-olds. So that's my story. Thank you for listening.